Hello, hello, hello. It is not Monday. That's what I call Tuesday. This is Tuesday, August 22nd, day 58 for me on the Carnivore lifestyle. I apologize that I'm going to be wobbly today. I'm holding my phone instead of resting it somewhere. Um, but I think after today, I'm just going to check in maybe once a week or so because I'm just not that exciting, y'all. But I wanted to share today my why. In my very first carnivore related video, I mentioned my long list of diagnoses, and I went digging through my medical file trying to find the most recent printout. Duke Cancer Center no longer, or any of my doctors, print out for me things, after visit summaries, whatever, which is fine. It's all online. But from the Duke Health, Duke My Chart, I cannot print, not even a screenshot, which I guess is probably wise. So I found a couple of things from back when I was going through all of my reconstructive surgeries post breast cancer. The most recent printout I could find is this one from February 7th, 2022. And y'all, to go back and revisit this is pretty crazy. My list of what's next appointments was a revision of reconstructed breast, significant removal of tissue, readvancement and or reinsert flaps, autologous reconstruction, significant capsular revision combined with soft tissue excise implant-based reconstruction by Dr. Scott T. Hollenbeck. God bless him. But listen to all that mess. And this was a revision of what was supposed to be my breast reconstruction. What a mess. I've been through so many surgeries thanks to breast cancer, and another oddity, which we'll go over. But so I went back. That after visit summary did not contain my problem list. So I found another one. 2019 2021, where it actually lists my problem list. Look at that problem list. And this is no longer comprehensive because I've had diagnoses since this time. But here we go. This is my why. Polycystic ovarian syndrome. Obesity. My BMI at the time was somewhere between 30 and 39.9. I'll go turn to the first page, see if I can find out exactly what it was. Environmental allergies. I am allergic to animal dander. Invasive ductal carcinoma of breast, female, left. Custom breast cancer panel. Custom because I have, I was HER2. Well, no reason to go into that. My research self is kicking into gear. But because I'm inflammatory, which is a clinical diagnosis, there's no test to determine whether you're inflammatory or not. It's based on the presentation, the appearance of your breast. But also because I was borderline HER2, so they needed to do a custom panel on me. Myalgia, Taxol-induced, paclitaxel, one of my chemo drugs, gave me myalgia. Irritable bowel syndrome with both constipation and diarrhea. Neuropathy due to chemotherapeutic drug. Neuropathy, fingers and toes. Acute radiation dermatitis. So this was probably towards the end of my radiation therapy. I was burnt. So they radiated my neck, my left breast, and some burns went through to the back, but they weren't really terrible until the last week. That's when my skin was really peeling off. I had raw, open red wounds. So this must have been from the end of my radiation. Patellofemoral pain syndrome of right knee. Hot flashes due to tamoxifen. Now, tamoxifen is a medication given to women who are not yet menopausal, who had estrogen receptor and or progesterone receptor, probably positive cancers. They try to suppress the cells uptaking estrogen when you're not yet menopausal. I don't even know what this is. Due to medical condition of female patient. I honestly can't tell you what that even is. I'd have to look it up. vaginal dryness and vaginal candida. How embarrassing is this to talk about? But honestly, I'd just gone through chemotherapy, surgery, radiation, and I was on a medication to keep my body from using estrogen. So that just messed up my balance all down there. Overgrowth of certain things caused a lot of irritation and discomfort down there. And there was dryness, which was brand new to me at the time. An adherent scar, at risk for sepsis, open wound of breast, complicated. Open wound of breast. Yeah, okay. That's a whole different story. My cancer story and the sepsis thing is just an absolute mess. Internal derangement of right knee. So this was in February of 2021, so almost 2.5 years ago. Since then, I've gotten the diagnosis of being, I don't even know what they call it, but where my tendons are way too flexible. That causes my tailbone pain. I now, or before Carnivore, suffered with pain. They've switched me off of tamoxifen onto an aromatase inhibitor so that my body cannot produce estrogen at all. Not only now, can my cells not uptake it, but now I can't produce estrogen because I'm now postmenopausal. I've had my estradiol checked, or estradiol, however you say it, 3 times to confirm I am definitely postmenopausal now. Before cancer, I was not even perimenopausal yet. As a matter of fact, my OBGYN jokes that I just finally made it through puberty when I was 38 because I finally started having regular periods. But the trauma that my body has been through over the last 5 years, I'm now postmenopausal. But anyway, that's quite a list of diagnoses, y'all. That's my why. The arthritis is also new. And osteopenia, that's a big one. So I got diagnosed with osteopenia a year ago with my most recent whole body bone scan. I'm at a 13, I think, % risk of an osteoporotic break as of this year. Not osteoporosis yet, osteopenia. So I've gone through 2 infusions of a bisphosphonate medication to try to take calcium molecules out of my blood and push them into my bones. I don't know that I'm going to do that again. I've got my next infusion scheduled for January of 2024. And at this point, I'm not sure I'm going to do that. I've been watching, Dr. Elizabeth Bright and many others talking about how we actually can increase our bone density. I thought that was impossible. I thought once you lost bone mass, you were SOL, especially at my advanced age of 57 years. So anyway, that's my why. And so far, the neuropathy that was induced by paclitaxel, I have in both my hands and my feet, to the point where, so I lost my toenails during chemo, and my big toenails grew back and curl under on the sides. And because I have neuropathy in my toes, those nails, when they grow under, they press on those nerves, and it causes me excruciating pain. That has all but disappeared. I can go get my pedicure now and not flinch when she's handling my toes. I can actually feel things that I'm walking on now, whereas before I had a lot of numbness, especially the ball of my foot and my toes. My feet are almost completely neuropathy free now. My fingertips, it was so bad where I could no longer do my own necklace clasp or put earrings in because I couldn't feel with my fingers. I would be holding a piece of paper and drop it because I couldn't tell if I was holding it closed enough or not. I still have a little bit of tingling in my fingers. My neuropathy's not completely gone, but I can actually touch my fingertips now and I can feel that. It's pretty awesome. The tailbone pain, because of my tendon flexibility, is greatly increasing. I'm sitting here now. I'm out in the shed by my motorcycle. I didn't get to ride to church Sunday, and I guess I was kind of missing her. Plus, it's noisy in my house, so I thought I'd come sit out here. But anyway, I can sit. I can even sit properly, and my tailbone does not hurt me. I still have a little bit of trouble when I stand up. If I've been sitting for several hours, I'll feel some tension, some tightness, a little bit of pain. I stand up kind of slowly and I bend over and I stretch that area, but it's so much better. That I already in my first video told you about my ankle edema. It is gone. That wasn't even listed on here. And I should explain. So my doctor did not pursue figuring out why my ankles were swollen, because at night my ankles would go down to normal. So I'd wake up in the morning and my ankles looked normal. But as soon as I would stand up and start moving, my ankles would swell, especially my left one. So my doctor said she would only worry about it if I actually had swelling, while my ankles were elevated, and I didn't. So I never knew the cause of that, but that's gone. My ankles don't swell anymore. And I've been dealing with that since cancer treatment, and even before cancer, a little bit when I would travel long distance, many hours sitting in the truck, my ankles would swell a little bit. That's completely gone. Digestive issues. So in here it was mentioned that I have irritable bowel syndrome. That diagnosis is a diagnosis of eliminating everything else. So I've had upper GI scopes, I've had lower scopes. They couldn't find any cause of my pain. Now I get what I call, my family and I just call them gut attacks, where suddenly I have to go disappear from people and I will cry, sometimes moan and even scream in pain because my gut hurts me so bad. And I finally figured out what it is it's a buildup of gas in my intestine that gets trapped, but it's not a static amount of gas. Like my body just keeps producing the gas, so it gets larger and larger and larger. It's usually in my lower right quadrant, and they did find that I have almost a hernia down there. Almost, there's a fine layer of some sort of tissue holding that bulge in, but it could eventually protrude. And they said, well, maybe it's because of that, but we never really knew. But my body would just produce a ton of gas, and it would get trapped in my colon, and that distension was so painful, and then the gas would keep building and I couldn't relieve it. My daughter and I used to joke that I needed to have a pressure relief valve surgically inserted right there so I could just press it and release all the built up gas. And I know that sounds disgusting, but that's exactly what it is. I could not get the gas out of my body, and yet my body would just keep producing it. So anywhere from 40 minutes to the longest I had was a 3-day gut attack where I was in pain, could not relieve the gas. I would change positions, stand up, sit down, try to eat, try to have a bowel movement, all the suggestions they have to relieve trapped gas. None of them would ever work for me. Eventually it would dissipate and I would get better, but we never knew how long it was going to last. I don't have that anymore. Even when the gas would not get trapped in my colon, I would have a lot of digestive issues where I did a lot of sounding burps, just little bitty burps, trying to relieve this stuff in my stomach. My ex-husband used to laugh at me about it, and it was embarrassing to be in public. I'd have to hold all that in and go excuse myself, go somewhere else and release all these burps because it wasn't ladylike and it was disgusting. My point is, I had a lot of digestive issues that were undiagnosed. They tested for, bad bacteria buildup. I was free of that. My scopes were always clean. I had some minor diverticuli, but they were normal for my age. I did have my gallbladder removed when I was 29. I told you in my first video I think it was my most recent video about my first gallbladder attack when I was 15. They didn't know at the time what was wrong because they did an x-ray where I swallowed barium and they couldn't see anything wrong. So for 14 years, I battled severe gallbladder disease and didn't know it until I was 29. I was sitting in nuclear medicine. I was lying down on a table in nuclear medicine. They had injected me with a dye, and I was under this imaging machine, and they said it would take about an hour for the dye to pass through my system. 3 hours later, I was still on the table, and then they came in and had me sign a permission to rush me into emergency surgery. My gallbladder was taken out when my fourth child, my daughter, was 2 weeks old. I was rushed to emergency surgery to have my gallbladder removed. Again, at that visit, until nuclear medicine, All of my enzymes were clear. The CT scan didn't show anything. They didn't know what was wrong with me, but I had been taken to the hospital in an ambulance because I had been throwing up after eating some crackers with peanut butter. They couldn't tell what was wrong until I went to nuclear medicine, and then they rushed me to emergency surgery. 29 years old, having my gallbladder removed. So my gut has been a mess since I was 15, and now I don't deal with any kind of discomfort in my stomach. I can easily digest my meals. I am not laying in bed at night chewing Tums. I've got this huge bottle of Tums from Costco on my nightstand. I don't have to chew those anymore. I mean, it's just, y'all, I cannot explain to you what being on a meat-based diet has done for me. My right knee, I don't know what the plural of meniscus is. I say menisci, but I really haven't looked it up. But I know I've got 2 torn menisci in my right knee. I would have to look up that visit with my ortho doctor to tell you exactly what they are. If you really want to know, I'll find out. But I've got 2 torn. I've got a Baker's cyst. I've got arthritis, a degeneration in that right knee. It is painful, and I go to get steroid injections just to control the pain. My knee still feels weird when I first stand up in the morning. It's almost like my knee has to adjust back down into this position before I can walk. I've got to be really careful how I step because the knee just isn't well supported, and it's just been extremely painful for me. I'm been discouraged because here I am in my 40s and 50s, and I'm already losing mobility, the ability to do things that I love. And so I've been getting these steroid injections. Well, I can't explain it, but my knee's getting better. I guess it's just the inflammation that was in the knee. I know the knee's not going to repair itself. It's not just going to magically get better, but it feels better. And I'm able to move without thinking about my knee, which astounds me. And then the one other thing that has improved already, again, this isn't mentioned in here because I just learned this when I went to physical therapy for my tendons in my tailbone. It was funny. So the tailbone pain, my primary care said, well, I can send you to physical therapy and they can do this internal PT. She said, it sounds kind of weird. They're going to have to go up inside one of your lower orifices. But they can massage that tailbone, which might relieve that pain. So I agreed. I was to the point where it was so painful to sit and stand. I couldn't ride my bicycle. I couldn't ride my motorcycle. So I was willing to go for this internal PT, y'all. I was so nervous. But when I went for my initial PT evaluation, they pressed on the outside of my tailbone and had me hold myself in different positions, and they determined that my tailbone has plenty of mobility. There was no reason to do an internal manual manipulation of my tailbone because it already moves just fine on its own. I was never so thankful in my life to not have to go through some sort of treatment. But that was when they discovered that my tendons were way too flexible, and then they, tested my body, and apparently all over, I'm just super flexible. But going through that PT, when they were trying to teach me to strengthen my core muscles and how to breathe properly, I don't even breathe properly, so that my muscles would do the work that my tendons were currently doing. We had to strengthen my muscles. They told me that I had a pretty advanced case of rib flare. Now, I'd noticed this myself, that my lower rib cage, was starting to stick out. Like even when I would suck in my gut, my ribs were sticking out below my breasts a lot further than they normally did. And it looked really odd to me and I couldn't explain it. But at this point in my life, I've had so many horrible things happen to me physically, with my health. I just couldn't handle one more thing. So I just had been ignoring how I noticed that my ribs were sticking out. Well, then my physical therapist tells me I have a pretty advanced case of rib flare. Rib flare, it turns out, is a result of weak core muscles and or improper breathing. I mean, there can be other reasons too. But that's continued to be a problem for me. Even once I graduated from PT and I continue to do my exercises, my rib flare has been pretty prominent. Well, just 2 or 3 days ago, I was trying to find my waist. So I'm pretty boxy here. I don't have much of a waist, right? Further down, my hips flare out, but right here. So I was feeling, just trying to find my waist, and I was like, okay, yeah, there's my hip bone. My hips come up pretty high, and there's my oh my gosh, my ribs. My ribs aren't sticking out. I'm gonna push in my fat. My ribs, my ribs were sticking way up. My lower rib cage flared bad, and I went running into my daughter's room. I was like, Pepper, you're not gonna believe this. I can't explain it, but my ribs are going back into position since Carnivore, and I hadn't even noticed until I was just trying to figure out where my waist was. So now y'all know a little bit about my why I'm Carnivore, and how I've already seen so many improvements. A lot of my diagnoses, I won't know whether they're better until I go for additional blood work, or until I have another bone scan, or, inflammatory breast cancer has an extremely high recurrence rate, in the median life expectancy, the best they can tell, because there are so few breast cancer patients with inflammatory cancer. They estimate that less than 3% of breast cancer cases worldwide are inflammatory. So there aren't even enough of us to do significant research on. They don't know a lot, but the best data that can be gathered is that the median life expectancy post-diagnosis for an inflammatory breast cancer patient is 3 years. Well, I've made it more than 5 years, and I'm still what they call no evidence of disease. I just had my bone scan again because I was experiencing this bone pain, this myalgia. So they thought maybe I had bone metastasis, but my bones are clear. There's no evidence of any tumor cells anywhere in my body. So until I just managed to live for decades and decades and decades, we won't know if I've truly beaten inflammatory cancer or not. But I do believe that the best insurance I have to make sure it doesn't recur is to continue on the carnivore diet, simply because all of these things that I've listed, they're so much better. And I'm so thankful. I already knew God had miraculously healed me of a cancer. By the time I was out of chemo, my tumors were gone, and my affected lymph nodes had shrunk back to normal size. That wasn't supposed to happen. The only reason they gave me chemo was to try to shrink my tumors, so that when I had my mastectomy and the removal of the lymph nodes, there was a greater possibility that they would get all of the cancer. But when I was done with chemo and I went for my scan, they couldn't find the tumors. And I knew at that point in time, God had miraculously healed me. And here I am 5 years later. I did go ahead with all of the treatment, and so far I've done everything the doctors have asked of me. That's beginning to change. I've already gone off my aromatase inhibitor. The side effects were too great. Not having any estrogen production in your body, for me, it wasn't acceptable. I gave it my best shot. I was on the first medication, tamoxifen, for 4 years, and then they switched me to the aromatase inhibitor, and I made it 8 months, and I just couldn't do it anymore. But anyway, I already know I'm doing so much better, and you now have a list of reasons why I'm going to stay carnivore, why a meat-based lifestyle is the only way I'm going to live. And I'll check in from time to time, let you know how I'm doing, and I'm going to become your cheerleader. If you need somebody who's going to cheer you on, I'm not a medical professional. I can't really explain to you the whys of what's happening. I mean, I've gleaned from watching many other doctors, but I'm not going to spout that as my own research, my own truths, because I don't want to get in trouble for stating things that, I can't prove. But I will cheer you on, because it's so worth it, y'all. So worth it. Thanks for listening to my whys today. God bless.